welcome back to my channel. I'm Dr. Amit Kumar Bhanushalli, and today I'm going to discuss about a very common health condition which is called as acidity or heartburn, or in a medical term it is also known as gastroesophageal reflux disease. Sure, most of us experience this condition on our day-to-day life, and majority of us have a very weird kind of misconception, a wrong information regarding this problem. What is the problem is, most of the time people who have this problem, this reflux, the acidity, they tend to just pop in a tablet, which is most likely some tablet that reduces the acid production, or they just have a sip of a syrup or antacid. So they try to just suppress the acid, because most of the time we see some advertisements on TV, and even the doctors sometimes they say that acid is not good for you, it's gonna cause some problems to you. Yeah, it is going to cause some problems, but acid is never bad. See, there's a reason why our stomach is producing acid. Well, we don't produce acid anywhere else in the body, it's just the stomach. The reason behind is there are two reasons specifically. Stomach acid is really good for us because it has a protective mechanism. So whatever food you eat, or anything that enters through your mouth, it protects our whole system from the bacteria or virus that we are ingesting with our food. Okay, it has a protective mechanism. Secondly, this acid is really good. It helps in digestion of a lot of proteins, and it helps in vitamins, a generation of vitamins and minerals. So like vitamin B12, I will explain it later, but it is very important that it plays a key role. The acid is very important. So if we try to suppress this acid production for a very long time, well, it's not a good idea, because if you stop the acid production, there will be a condition which is called as atrophic gastritis, which is also not a good condition. Basically, again, it will end up into developing a stomach cancer. And you will even before developing a cancer, you will be experiencing some loss of vitamins and minerals. So there will be deficiency of all these things. So it's a good idea not to switch to medications unless and until it is very necessary. So in this video, I'll be mostly focusing on the causes of this condition, because you should understand what is the cause of this condition. Then only you will be able to understand how will you deal with this condition. Okay, of course I'll be talking about the complications. So about this reflux disease, mostly the most severe complication is esophageal cancer. So people are not aware of that because they just take it too casually. Okay, so esophageal cancer is a serious complication that can happen if this condition is ignored. Okay, and there are a lot of other things that I'm going to discuss. Primarily I will be talking about the treatment algorithm. Okay, it's not a flow chart, but I'll be focusing on things that you should do and things that you should avoid. Okay, my whole focus will be on the lifestyle and dietary modification. Of course, I'll be talking about some medical management as well, and the surgical management as well. Alright, so now I'll be explaining you a little bit of anatomy, simple anatomy, so that you can understand this condition in a better way. Alright, so here you can see it's our stomach here. This is our food pipe, and we are only concerned about this cardia part and the fundus part and the lower part of the food pipe, which is called esophagus. Okay, so this is the area of our concern and where our problem is happening. Okay, so now you can see here in the another diagram more clearly. You see this is the end of the food pipe, and this is the beginning of the stomach. Okay, and you can also appreciate that there are some different you can see this is the different material with which our stomach and food pipe is made. You can see some wavy lines in this stomach region and some parallel lines in your food pipe. Now the difference is here that of course they're made up of cells, but stomach has a very thick layer of mucus, or you can say a very coating that protects the stomach itself from its own acid. It prevents it from burning from its own acid actually. But our food pipe, the esophagus, it does not have that thick layer. It has some thick layer, but not as thick as what our stomach possess. So it is not made to bear the constant impact of the acid that is coming up again and again. So that's why when the acid comes up, so you can see here in the other diagram, so this is the acid, and when it comes up, it burns, it literally burns your food pipe, and that's why you feel that burning sensation right at the back. And it may also travel up to your throat, and at that point you may feel some oral brash, we call it, like a sour taste in your mouth. And this sour taste is because of the acid that is just jumping up throughout the whole esophagus, because esophagus is like 25 centimeter long tube, and sometimes the reflux is so strong that the acid can travel up, and it can cause some irritation in your throat, feel like lumpiness here as well. And sometimes you can see here this acid can even damage your vocal cords, your voice box. So you can also feel some hoarseness in your voice as well sometimes. And people who are having too much of oral brash or too much of bitter or sour taste because of this acid reflux, they tend to develop some erosion of the enamel of their teeth, and the teeth becomes quite prone to high sensitivity, and they have some irritation in their mouth. They have some bad foul breath as well. Their teeth become very brittle. Okay, so these are some of the problems that some of you might experience along with the acid reflux. Now let's talk about the causes of reflux. So basically it comes into three categories. One that increases the gastric pressure, I mean the pressure in your stomach increases, something that increases the pressure. Other is something that increases the acid production, and the third one is something that relax the tone of your lower esophageal sphincter, I mean the lower part of the esophagus. As you can see here in the diagram, this is ideally it should be closed. You see this is lower esophageal sphincter, okay, but in case of reflux it is kind of open, and you can see the acid is refluxing upwards and burning your lower esophagus. Okay, so this is the main problem. Now we'll talk about the causes under these three different categories. Okay, the first one is as I mentioned, something that increases the intragastric pressure is you can say this. Oh, looks very delicious, isn't it? But having a large meal, so it can cause a lot of problem here. Although it's very delicious, very tasty, mouth-watering, I can say that. But you can see here, when you have too much of food, this area gets bigger, it dilates, and hence allows the reflux. Okay, other cause is in case of pregnancy. Now in case of pregnancy, you can see if the baby is growing, and this is your stomach. So as the baby grows, it puts a pressure on your stomach. Okay, and as a result, when it puts a pressure on your stomach, the space inside your stomach decreases, and as a result the pressure in your stomach increases, and as I mentioned, the pressure increases, reflux increases. Also in pregnancy there are hormones like progesterone and estrogen which are really high, and those hormones, they specifically work on this lower esophageal sphincter. They cause relaxation. They have this effect of relaxation that increases that relaxes your lower esophageal sphincter is your beloved coffee. Okay, so caffeine or coffee, anything rich in caffeine can relax your lower esophageal sphincter, and also it can increase the acid production as well. Along with that, the chocolates, they also do the same thing, although not as severe as coffee, but they have this effect as well. Now other than that, you can see here, yummy, isn't it? High fatty food. So high fatty food, fried food, they all cause this problem. They also relaxes the tone and also increase the reflux. Plus when we eat this fatty food, we eat a lot, we binge eat this. Again there will be dilation, expansion of your stomach, and again that's the issue. One more thing, midnight cravings. People who eat at night, they feel hungry, or they are awake. First of all, they are not sleeping, and that is one more reason that causes increase in acid production. And on top of it, they start eating at night.
and this again dysregulates your whole digestive system and your whole metabolism. Also disturbs a lot of hormones in your body. Other causes of relaxation of lower esophageal sphincter and increase in acid production is this. I think many people love this alcohol, and any kind of alcohol, could be beer, vodka, whatever. They all burn your esophagus, okay, and they aggravate the acid production. They have a very toxic chemical burn in your lower part of your esophagus, which is not good at all. Now, other than that, this is quite common. Tobacco chewing and smoking both have the same effect. They damage the esophagus. Even smoking is considered one of the main reason of getting esophageal cancer. And nonetheless, the tobacco chewers, they can have oral cancer for sure. It's written on the packet itself, but they are also at high risk of getting esophageal cancer, because people who are tobacco chewers, smoker, they drink, they binge eat at night, fatty food, they're first of all obese. Okay, obesity is also one of the reasons for reflux. So all of these things can add up to obesity, and obesity is again one of the risk factors for developing reflux and eventually esophageal cancer. So all of it kind of sums up into one thing. So these are the reasons. These are the most common reasons that we face in do in our day-to-day life. It is a very bad lifestyle that we live. Other than that, we can have reflux, increase in acid production with some of the pain medications. Like people take pain medications like ibuprofen or diclofenac very often without even consulting a doctor. And these medications can also increase the acid production in your tummy. Let's talk about the management now. So I'll be primarily emphasizing on the lifestyle modification, which will include dietary changes and exercise and other habits. Okay, so the first in the list is having an uninterrupted enough sleep for like 6 to 7 hours. Sleep plays a key role in your overall hormonal balance. So if your hormone gets imbalanced because of lack of sleep, then you have very high chance of getting a reflux. Okay, and there's a particular way that you have to sleep. So let me show you this picture here. So as you can see in this picture, that a guy is lying down at an angle of like 20-25 degrees. So you need to create this kind of angle. If you don't have this special kind of pillow, you can just have a stack up 2 or 3 pillows and create this an inclination and just lie down on that. That will be the perfect way of sleeping for people having reflux, because this will, using the gravity, we can just prevent the acid from getting up. It is as simple as that. Okay, now the next thing is having plenty of fluids and electrolytes in a day. So that goes without saying, of course. Okay, so what all things that you should avoid? Well, the list that I mentioned, the things that are causing the reflux, you should avoid them. Like you should avoid coffee, caffeine products, chocolates, and all those things that I mentioned: high fatty food, garlic, onion, soda, etc. Okay. Even the white breads, like white bread items, all the pizza base, burgers, the bread, even that can cause reflux. Okay, so you should have to avoid that. All the bakery products, basically. And one more thing: before you sleep, you should at least eat your dinner or 2 to 3 hours before you sleep. Okay, not just right before you go to sleep, because that is just irrational and illogical. It will just worsen your situation. Okay, so try to at least not 3 hours, just 2 hours at least before you go to your bed. Okay, and other than that, okay, you have to reduce your belly fat. Of course, you can do that by doing exercise, but not just exercise. You have to focus on your diet. Now, a lot of grain source of fiber like oats and barley and ragi, they are good source of fibers, but they can also aggravate your reflux. So in that case, you can use plant fiber diet. What I mean that you can see here in the picture here, you can see this veggies. Okay, a lot of veggies. This can just help you out with managing your fat and also give you enough fiber to prevent constipation. Okay, so you can see ginger here. Now ginger is very important. Whenever you feel a sensation of reflux, just chew a piece of ginger. It has a very good anti-inflammatory property. Okay, so you can just have ginger, and whatever you are seeing here in the picture, it's all perfect. Okay, it's all safe for your reflux. Next is, you can see here the protein bowl here. So you can see high protein diet. This is the protein source, this is the protein source, this quinoa, and the fibers, plant fibers, broccoli, they're all fantastic for the acid reflux patient. Like if you have this kind of diet every day, you will never need medications at all in your life. Your reflux will be sorted on its own actually. And the benefit is you will be having a very healthy lifestyle. You will be looking great with loss of fat. So this is a good idea actually. And of course, if you have been prescribed with medication, you have to be very much regular with the medication, and you have to take it at regular doses. Don't miss the dose, please. Don't miss the dose. People tend to forget about the medication once they start feeling better, but that's not the case actually. Also, yogurt plays a very important role, because probiotics, the normal bacteria in your gut, they are very important. They plays a crucial role in overall gut health. So if you have yogurt, it's a good idea. Plus, it's a good source of protein. Now let's talk about some of the complications of GERD. Okay, so this complications arises when you ignore your problem and you're not regular with your medication, you're not compliant with your diet and exercise. So this could be the complications that could arise. So initially there will be esophagitis. Basically, it is a soreness and swelling in the lower part of your esophagus. It usually gets due to the burning after the acid reflux. So this is the initial stage. Most of us experience this kind of we are at this stage. Okay, so if you don't look after this, if you don't take medication, it can progress to either a stricture. Basically, there is a fibrous growth. It gets narrow, and at that point you feel uneasiness. When you eat, you feel like stuffed up food behind your chest. After you eat, you feel like it's stuffed up behind. That's called dysphagia, and that is also not good, because even that can also eventually end up into cancer. Okay, and if not, then it can progress to a different phase of complication, which is called Barrett's esophagus. Now Barrett's esophagus is a kind of a change in the material of your lower esophagus. Okay, and this is a pre-malignant condition. That I mean to say that even at this stage also we can reverse our problem back to normal as possible, but not 100% normal. But if we don't look after this problem at this stage, then it can progress to cancer, which is called a tumor, esophageal adenoma, or cancer here, cancerous growth. I'm sure nobody wants that. So this is the kind of a timeline. It takes a lot of years, but you see, if you don't look after your esophagus at the early stage, it can progress to this level quite fast. And even if you have other risk factors like smoking, tobacco chewing, alcohol, all that things that I mentioned before, then this process is going to speed up. Okay, so I already talked about the lifestyle modification. Now we talk about the medical management, which your doctor or physician may prescribe you. Usually they will prescribe you 3 types of drugs. Nowadays they are going towards PPIs, these proton pump inhibitors. Basically they are omeprazoles, pentoprazoles, rabiprazole, esomeprazole, all the prazole group of drugs. So basically they prevent the acid production and decrease the acid production in your stomach, so that there is no reflux, not too much of acid that to reflux back. But again, as I mentioned, this medications have some side effects if you take it for a very long time. Ideally, according to the protocol, a doctor will prescribe you to take this medication for 8 weeks continuously, daily, 1 tablet. And if they see any improvement, they will definitely advise you to stop the medication. But if they don't, they may ask you to increase the dose or maybe have twice a day. But again, as I mentioned, if you take it more than like 2 or 3 months, then you can experience some serious side effects of this medication. But if you take it for like a month or 2, it's not that serious side effect. But again, if you don't want to experience any of the side effects of medication, go for lifestyle and diet modification. Okay, now if the medication is not working and your diet is also not working, we call it as a refractory case. In that case, we have to go for surgery. Now if there is a development of complications, like if you develop stricture or Barrett's esophagus that is not getting better, we have to go for a surgery. Now the surgery is called laparoscopic Nissen's fundoplication. Well, it has a fancy name, but it is a surgery through keyhole surgery. We make 2 small cuts in your abdomen and we fix your stomach. I will show you the picture of Nissen's fundoplication here. But again, bear in mind this, any of the surgery has its own complication. Although it has 80% success rate, but still surgery is a surgery. It has its own complication. Not everyone can bear a surgery, so it's better to go for your dietary management. I will just show you the picture of Nissan's fundoplication so that you have an idea. Now regarding surgery, as I mentioned, it is a laparoscopic procedure. So as you can see in this diagram here, the surgeon is gaining access to your stomach through small holes, small surgical incisions, and to start the operation here. And what the idea of this operation is, you can see here, basically the surgeon will take the upper part of the stomach and it will just wrap around your lower part of the esophagus, making it as like an artificial sphincter. You can see this is the end product of the surgery. So basically this will act as your the function of your lower esophageal sphincter, which is supposed to be stay contracted, stay closed. Now this will kind of fasten it up more and it will keep it closed. So this was the surgery.
So that was all about the acid reflux disease. I hope this video was helpful for you guys. You understood what the disease is and what you can do about it. And if you like my video, please share it with your friends and families so that they can also benefit from this video. And if you have any questions regarding this condition, you can please ask me in my comment section. I'll be happy to answer you guys. And well, that's about it. See you in the upcoming videos. I'll be posting some more health conditions. If you have any specific request, please place it in my comment section. I'll be happy to make more videos like that. Thank you.